to look up and out and upon me, the rock, the river, the tree, your country. No less to Midas than the mendicant, no less to you now than the mastodon then. Here, on the pulse of this new day, you may have the grace to look up and out and into your sister's eyes and into your brother's face, your country, and say simply, very simply, with hope.
Good morning.
Good morning.
Buenos dias.
Good morning.
Good morning.
Good morning.
To the doctors, nurses, and healthcare professionals who are risking their lives for our community, thank you.
Son en verdad unos héroes y los aplaudimos. Le damos muchas gracias por todo lo que hacen y su dedicación.
Thank you for being there for our loved ones when we cannot. And thank you for being there always, no matter what.
I'm personally grateful for your courage and dedication to serving your patients during this global pandemic.
We want you to know that we do see you and we appreciate you. Our prayers go out to you and your families during this difficult time.
You inspire us each and every day as you selflessly put the health and well-being of others before your own.
I would like to say thank you to all of our courageous healthcare workers who are taking great care of our communities. You are the best of the best.
Mil gracias por su esfuerzo y sacrificio personal y especialmente el sacrificio de sus familias.
Thank you for answering the call, and thank you for being a light in a dark place.
Thank you for upholding your oath and continuing to keep us safe out on the front lines.
My Arena is women and gender policy.
My Arena is
international trade and diplomacy.
Health policy.
Water policy.
International finance and trade.
Increasing equity, access, opportunity, and belonging.
My Arena is getting more women involved in politics.
And my Arena is human security.
Lift up your eyes upon this day breaking for you. The horizon leans forward. offering you space to place new steps of change. Here, on the pulse of this fine day, you may have the courage to look up and out and upon me, the rock, the river, the tree, your country. No less to Midas than the mendicant, no less to you now than the mastodon then. Here, on the pulse of this new day, you may have the grace to look up and out and into your sister's eyes and into your brother's face, your country, and say simply, very simply, with hope.
Good morning.
Good morning. Buenos días.
Good morning.
Good morning.
Good morning.
Blue Cross and Blue Shield of Texas is a proud supporter of the festival. We believe public dialogue and civic engagement play important roles in improving the health and well-being of Texans across our great state.
I'm Evan Smith, the CEO of the Texas Tribune. On behalf of my colleagues at the Trib, I want to welcome you to this year's Texas Tribune Festival. Every one of our 11 years in business, the work of our nonprofit newsroom has been critically important, but never more than in 2020. We produce reliable, credible reporting on issues that affect everyday Texans, making them better informed and motivating them to participate civically. You and people like you, readers, donors, attendees at our events, make that possible. This month, as part of our fall drive, we're hoping to sign up 500 new members. Go to texastribune.org/give and support our efforts to create more thoughtful citizens through public service journalism. Now on with the show. I hope you enjoy this conversation between Harris County Judge Lina Hidalgo, Dallas County Judge Clay Jenkins, and Texas Tribune reporter Juan Pablo Garnham.
Hello and welcome to the Texas Tribune Festival. My name is Juan Pablo Garnham and I'm the urban affairs reporter for the Texas Tribune, and I'm super excited that we have today here two key figures in what's been the response to the coronavirus pandemic here in Texas. We will have a session that will last 30 minutes, and let's go to it. First, I want to welcome from Houston, Harris County Judge Lina Hidalgo. Bienvenida, Jueza Hidalgo.
Gracias. Thank you.
And just some minutes away from where I am here in Dallas, I want to also welcome Dallas County Judge Clay Jenkins. Judge, thank you so much for being here.
Gracias and welcome. Hello.
That's good. We're going to do all of our questions now in Spanish, Judge.
Great. Sounds like a disaster. Let's do it.
Okay. Well, to start, I wanted to ask you about partisanship and the pandemic. Judge Hidalgo, conservative advocates have sued you several times since this pandemic started for your orders. Judge Jenkins, you were in the center of the controversy when an owner of a salon, Shelley Luther, refused to close her store, and she might run for office now. I've been asking myself a lot why here in the US, why here in Texas, the response to this health crisis has been so politicized. Was there another way, or is it simply the way things were supposed to be? And let's start with Judge Hidalgo.
I think there was absolutely another way, and we lived it. Remember at the beginning of the pandemic, and of course I can speak for my county, for my community, but I believe we saw similar things around the state. It was folks banding together. We saw what was coming our way. We saw what happened in other countries. We saw what happened in other areas in this country. We knew what had to be done. We knew the limitations that the nation faced when it came to testing, and so we made do with what we had. People worked together. They did amazing. They sacrificed. We're used to this. For our part, hurricanes like the one that almost came our way just last week, and the results of that were beautiful. The curve that was speeding up, it was tripling, I think, every 2 weeks, all of a sudden flattened through hard work. And I was working with, and still am, mayors. We have 34 mayors in Harris County, Democrats and Republicans, with our neighbors in other counties, our surrounding counties, of course, with other counties around the state, Judge Jenkins, the other large counties. And I think that eventually that political pressure won, but it didn't have to. We didn't have to cave to it, or folks didn't need to. Certainly, I've worked very hard not to go down that path, because to me, we're all putting out a fire together. And so it's important for me to be able to work with the governors, to be able to work with the mayors, with the other judges. So no, I don't think it was inevitable. And I think even now, it's not done, right? Even now, when we look at schools, when we look at other actions, we have to put politics aside. It's something we normally do during emergencies.
Mm-hmm. Yeah, and it's something I guess we're seeing with the hurricane. Judge Jenkins, do you agree in that sense, or do you think that someone could also say everything's political, everything's politics? Do you think that things could have been different here?
Well, I think absolutely. The difference in this epidemic and the things we've seen in the past is Donald Trump. The president said this was a hoax, and then he made everything about it through partisan lenses and personalized it to him. And that's really the difference in this. I led our Ebola response, our West Nile virus response. I know Judge Hidalgo has led hurricane responses, and those have not been political. But the president politicized this, and then we have weak state leadership here, and they could not stand up to President Trump. Look, some of us decided to follow science and are still doing it. We're not making decisions based on what we think is politically expedient. I have panels of scientific experts here who I never met before this pandemic, who advise us on what should open and what should close and how we should conduct ourselves, and we follow that. I'll tell you, when I worked with Governor Perry, he's a Republican, I'm a Democrat, it was never political. I think this administration just cannot stand up to President Trump, and it's led to some pretty disastrous results.
Mm-hmm. And Judge Hidalgo, can you give us a sense of how has this limited or changed the way that you will respond to another kind of crisis? I know that all of you judges, you are in constant communication. I think you text to each other. Can you give us an example of what happens behind the scenes, and in what way this politicization of a crisis has been different from, let's say, the hurricane?
We did fear that last week, right? We were watching the storm coming our direction. We were running all kinds of scenarios. There were different models that told us, okay, if it comes this way, this is how many people would be impacted in this way, this is how long it would take to evacuate them, and this is the last minute we have to make that decision to do a mandatory evacuation. And so we made the decision to do a voluntary evacuation, and all the steps that we took, and fortunately we were not severely impacted here in this area. Of course, our neighbors to the east were, and but we were concerned. We said, okay, does the politicization of the virus response mean that folks suddenly will politicize the hurricane response? And we were bracing for that. So what we did, make use of all our tools, the wireless emergency alerts that go to people's cell phones. So we targeted those specifically to the areas that we were asking to evacuate, alerts on social media, very clear communication, working with all our partners, again, speaking to all the mayors in that area, the judges all along the path of the storm. Thankfully, we did not see evidence that folks were saying, well, I disagree with the politics on this, and so I'm not going to do my part, as part of the community. So that, it's sad that we even have to consider that, worry about politics getting in the middle of a life or death issue. If the hurricane had come our way and if people had not left, it was a last minute speeding up and tightening up of the storm. But if it had kept the way it was going, certainly there would have been some impacts. So, and of course, it's sad that has been the case for the pandemic. The mask order is a perfect example. Had we done that back then, how many lives, how much would the economy have done better? How much more sustainable would things be had we not reopened too soon to pander to certain interests? Perhaps, or surely, we would be where other communities are who stayed the course until they crushed the curve. So I hope it's a lesson, and that, right now we continue to do that. I'm appreciative for the great relationships I have with so many of my colleagues, but I do think that there was a lot of pressure to make things political, and I do think, some folks caved to that, and that's just really sad.
And Judge Jenkins, now just this week, Governor Greg Abbott tweeted that, and he has said this before, that there will be no more lockdowns in Texas. How does that make you feel? Is that something that worries you, like to see this idea repeated rather than having more flexibility?
We didn't ask for a lockdown. What we asked for from the doctors, the main thing we asked for was to shut the bars down and masking. Most of the things that Governor Abbott, all the things that Governor Abbott has done have been demands from the county judges in the large urban counties. The only things that he didn't do that they asked to do a couple of months ago was close restaurant in-person dining for a time. But now the doctors have said that can open, at least here in Dallas. So what the governor likes to do is create straw men or fictions that we're all asking for something that we're not asking for, and that he's stopping that from happening. What he's actually doing is what we're demanding that he does. He's just doing it way too late, usually like 3 weeks after we start demanding it.
And I think it's important to explain to people what's the relationship that judges have with the governor, because it's not the same that a mayor or a city council has with the governor, right? And with the state as a whole in terms of funding, and you depend on the governor, right? I don't know if Judge Hidalgo, you can explain a little bit about that.
Yeah, so our positions ultimately are an arm of the state, and we help manage the budget for our respective counties. One thing that has been interesting in this pandemic is, by statute, we have certain authority during an emergency, particularly, and Judge Jenkins will know this forward and backwards as I do, is controlling ingress and egress. There's just certain language in the statute, is I think 218 or and it's very key, and it's what allowed us early on. Me, for example, as soon as I saw this coming, called up my colleagues where they had an eye to the future, right? I could see the future through them. And they said, you got to do A, B, C, D. So we sat down and we did it because we could. When the governor reopened things at the end of April, his order had a clause that said something along the lines of this piece of the statute 218, the one that grants county judges their authority during emergencies, is now suspended. And so that's what has meant since then that all we can do is what they authorize us, what the state specifically authorizes us to do. Of course, because the legislature is not in session, there's nobody to challenge that. And so where, I had the authority on masks, I had the authority on restaurants, on all of that, certainly wouldn't have opened as quickly as it was. Once he decided to open, I said, all right, let's make this work. It's always been about staying ahead, protecting the people. So we had contact tracing program. The day after he announced the reopening, we announced tracing, testing, and treatment. Within 2 weeks, we had over 300 contact tracers ready to go, deployed. We had a hotel program for first responders who needed to isolate, who might have the virus, nursing home program to go in there proactively and test everybody, not just in nursing homes, but in other facilities where people live close to one another, childcare, everything under the sun. But we were suddenly stripped of the authority to help give that clear guidance, those clear requirements to the community, which I believe really was the fatal flaw of this, and why, for me, we can't make statements like we will never do X, or we will always do Y, or things will be open by this date, because we have to go by the numbers, the thresholds we've set out, and the best practices we've learned.
You mentioned masks, and I wanted to ask you about this particular moment in June that I think it's been, for me at least, it's kind of like a milestone of these tensions, that it's when Bexar County Judge Nelson Wolff actually ordered businesses to require masks for customers and for workers. For some, that was a gamble, and for others, it was a direct act of defiance, right? Judge Jenkins, were you aware that this was going to happen, and how did you react when this happened?
Well, I think the saddest part of it was the governor's response was that we had finally figured out the riddle. And of course, it shouldn't be a riddle. It should be about keeping people alive and keeping businesses open, which is what keeping the spread of COVID down does. We had actually, when the governor did his Open Texas orders, we had made all of his suggestions mandatory in Dallas, which includes wearing masks inside businesses. And he had his Attorney General, Ken Paxton, write us a cease and desist letter. So the reality of it was that the governor at first didn't want masks to be enforced, and then changed his mind with the overwhelming pressure of the medical community and tried to spin it as if we had the authority to do it all along, but we're just too slow to figure out his riddle. That it's just been very confusing leadership and a real lack of communication from the state. But we banded together, the county judges and the medical community, and we powered through it with a vacuum coming from Washington and Austin. And really, it's been the locals and the health community that have led the response.
Judge Hidalgo, were you surprised, or was it something that you were aware? Like, how did that happen? I know, like, we've been talking about like the conversations that you have between the judges. Was it something that in any way you were informed, or was it something that surprised you?
No, I'm glad it was done, right? I'm glad it was done, and all of those tools that have been available to that limiting gatherings, outdoors, which is kind of odd because we know that there's less risk outdoors, but hey, we'll take it, right? All of that, when we did have the authority to regulate what schools did, we jumped on that. So it's a good tool. I'm glad it was done. I obviously, if I'd known, I would have done it. We've got very smart lawyers over here, but that doesn't mean I didn't welcome it, and it was tough to put the the businesses behind the 8 ball. I always thought this was a matter of personal responsibility. We asked folks to wear masks, so that was my concern. I spoke with the businesses, and that's where we all agreed. Well, it's like saying no shirt, no shoes, no service. So we just say no shirt, no shoes, no mask, no service. Mm-hmm. And we've worked very hard to support the businesses from the beginning. We had a county-funded grant program for small businesses, another, I think, $20 or $30 million with CARES Act dollars. We've used upwards of $130 or more million dollars in CARES Act money, plus around $40 million in local money that we've used to support businesses, renters, individuals through direct assistance. So, but frankly, it would be much easier for everybody, and it still can be, if we work together to really crush those curves, to not set out arbitrary deadlines, to not raise false hope. At this point, it'll be the third time around if we decide to again, open things too early. And then what are we going to do? Wait for the curve to jet back up and hope that happens, that doesn't happen before a vaccine, before a treatment? That's what has me concerned.
Mm-hmm. And it seems that that in a way there would be more constant process of this opening and closing. Is that something is that your assessment, Judge Jenkins?
Yeah, at this point, the ways that we can screw this up, we're in a good trajectory. The numbers are going down, at least they are here in North Texas. Everyone can go out and throw caution to the wind on Labor Day weekend, and that can lead to a big spike. We've seen that before. We need people to continue to make good decisions and wear those masks and be in small groups. Mm-hmm. We can mess up our school openings. And the third thing is completely up to the governor. He can make mask in Texas permissive, not mandatory. And everywhere where that's been done, we've seen the numbers skyrocket, more businesses fail, more people get sick, more schools have to close. Or he can open bars early. And everywhere where that's been done, we've seen a spread of COVID and more businesses fail. So we can either stand with the doctors on masking and bars and save countless other businesses and people, or we can cave into special interest and we can tell people that their personal comfort is more important than public health of others. Because remember, my mask protects you and your mask protects me. Mm-hmm. And so if I don't wear my mask, what I'm saying is, thanks for protecting me, but my comfort is more important than you are. And it's such a small thing. I'm reminded when I was in college, I was explaining to my stepdad that I didn't think I could make a good grade one semester. And he explained back to me, when I was your age, I was in England preparing to invade France in World War II. So I think you can make good grades. You think of what others have done before us. All we have to do to be patriotic right now is wear a mask. Mm-hmm. And all the governor needs to do is just not turn back the clock on masking and bars, and we can do the rest.
Mm-hmm. Well, and hope that the federal government doesn't try and go for herd immunity, right? That's the other thing that's got me concerned, is we don't even have evidence that people who've had the virus can't get reinfected. So that's all is multi-layered. I think part of the lesson from this is just the importance of unity and what happens when it's not there.
Let's talk also about other lessons. I'm putting the focus now more on public health than in the politics. Public health now, it's in the center of the conversation like never before. Like everyone's talking about things like positivity rates and vaccinations and hospital capacity and so on. And your counties, Harris and Dallas, not only are carrying the weight of the cities within the counties, but sometimes of the counties surrounding the areas. So, Judge Jenkins, could you tell me what kind of lessons should we in Texas take from this experience from a healthcare point of view?
Well, I hope what we'll take from it is that public health means everyone needs access to quality healthcare. Mm-hmm. And what we have now in Texas is hundreds of thousands of people in Dallas County and Harris County and millions in Texas who work for a living. They work to feed their families, but they only make $14 or $15 an hour. And so they don't make enough money for a healthcare subsidy. People who make $3 or $4 an hour or more get free healthcare because their healthcare, their Affordable Care Act or Obamacare subsidy virtually pays for their entire policy. But these are the essential workers that have kept our economy going while a lot of us have stayed at home and worked remotely. And they are people who are shut out of the healthcare system. So what we're seeing is less testing in neighborhoods where the patients don't have a pay source because the doctors don't build clinics there. All that can be solved by us just taking our portion of the federal tax dollars for Medicaid expansion. We're one of 11 states who hasn't done it. Oklahoma and Arkansas have done it. And it would bring in more money than it would cost even in the first year. So I'm really, really hopeful that now that people understand that public health means your neighbors don't get sick, and because this isn't the last pandemic that we may see, they'll find a way in Austin to pass Medicaid expansion.
Judge Hidalgo, I think that's kind of like the takeaway that a lot of people in the Democratic Party are saying, and leaders like you and the mayors. But can this be done, you know, especially when we are in a red state that has refused attempts to change coverage and funding of healthcare? Do you think that the pandemic will actually drive this change?
And I'm always positive. And Judge Jenkins mentioned, you know, only 11 states. Arkansas passed it, right? If they'll do it, I think never say never, right? That said, there are so many other issues that where the work really is cut out for us. Transportation is one. When we created our test sites, even though we have several and we have mobile sites, there's a huge barrier in Harris County. Not a thought was given long term to how to build a truly mobile community. A lot of people don't have cars. I speak with business leaders where I say, hey, what's the biggest thing you need from county government? They say public transportation, because their workers will quit because they can't get to work sustainably without a car. And that also translates into when you need to go get tested or you need to go to the doctor, and it's just hard to get there. So that's one. The politics of division. As much as I've been speaking Spanish on Spanish TV, exhorting people to get tested, inviting them, saying we're not asking for your ID, it's free, we don't ask for insurance. The Mexican consulate hosted a test site, and the line was miles long. And it was great that people were getting tested, but it was sad that people still were distrustful. And that is the rhetoric that is coming from the federal government. Of course, the environment, access to healthy food. We live in the shadow of industry here. We had a massive chemical fire that roared for days last year and have had explosions since. We know who lives in the shadow of industry. We know what communities have the kind of health conditions caused by where they live and the access that they have. So that's why we've been working on transportation in a holistic plan. That's why we've been made a historic investment in environmental policies. That's why we've been trying to look at health holistically, investing in health food initiatives. So there's a lot we can do. There's a long way to go because folks have not worked strategically with a big vision, measuring progress, having big goals on this for decades. But hey, we're coming. We're doing it in our counties, and you better be sure we're coming.
Is it going to be a little bit more difficult, though, to do it knowing that sales taxes, property taxes are down? We're already hearing of cuts on the state side, or transit agencies, both DART and Metro, are evaluating their budgets for the next season, and it's going to be a tough one, you know?
Yes and no, right? In the sense that it's about priorities, right? Budgeting is about priorities. I can tell you here, the budget used to be whatever it was last year plus 2% for inflation. There was not an analysis of why. How are you measuring success, and why are those metrics valid? For both capital improvement projects and just general budget items. So that's something that we're reforming top to bottom. It's not easy. It's a huge ship we're trying to steer. But instead of building more highways, how about we put bus rapid transit, trails? You know, we don't have sidewalks in some of our schools. We're working on it, right? So it's priorities. Yes, of course, the strategy of, you know, let's cut taxes, you got to have a proactive agenda. If your agenda is simply to cut taxes, how do you ever get anything done? And so that's something that, you know, with the revenue cap, we're seeing that per capita, there's actually a decrease in the investment from the county. And so as more people come here, we're going to be able to do fewer services per capita. It's a challenge with